what you do need on the Republican side, if the Republicans are going to kill this, is someone in the Senate who has the power to stick his finger in the dike. As Senator Grassley has said now, that's what he's been doing. Now, is that really what's going on here? Is this delay, is the Grassley-imposed delay in the Senate about killing the bill or about getting a bill?
Lawrence, no, it's about, let's take a look at this. I mean, when people talk about we don't have time to talk about it, we don't have time for people to read about this, and if it's such a crisis, why is the implementation date at 2013? And 2013 is not tomorrow, so they slow down. And it's legitimate for people to have a question, Lawrence, about the fact that if you ask somebody, would you like to have a free house? A lot of people say yes. But would you, if you ask them, would you like to have public housing? It's a totally different answer. And so
Congressman Bilbray, what would you be prepared? What would you be prepared to vote for? What could Chuck Grassley negotiate for you in the Senate Finance Committee that you would be prepared to vote for in health care reform?
First of all, give individuals the same tax credit that we give big business, big labor, and big government, the same tax benefits. That should be out there right away to allow people to independently do that. Portability is a major issue that we talk about. The pre-existing condition, I think, is something we can actually do. But let's remember, too, we need to look at tort reform. Let's get the lawyers out of the operating room. You know,
would you be prepared to vote for a bill that extends health care insurance and subsidizes it for people who currently cannot afford it?
Not only if they participate in a different type of program than what we've seen in a lot of places. I think what's exciting is that you look at Niki's state. Here's a state that's very aggressive. There's a state that can actually dive into it, and they got major problems.
So are you in favor of the Massachusetts plan? It was a Republican plan.
I think I'm in favor of Massachusetts. I'm very in favor of states being aggressive about this because they're small enough to be able to address it if they make a mistake. You got to understand, Niki's state is smaller than one of our counties. We got a county that's 50% bigger just in California. Niki's state is manageable. It's 6 million people. It's not 300 million people, which would be the largest healthcare system in the world by a magnitude of 5 to 6 times. I think Niki's state is taking a great experiment, and it's a great way that we ought to look at how can we work with them and see what works or doesn't work, because they've got a size that we can manage. We don't have to wait 60 years to admit we made a mistake.
Niki, you can tell Speaker Pelosi that Brian Bilbray is now in favor of insurance reforms and an individual mandate, as has occurred in Massachusetts.
Well, the Massachusetts reform has been an important one.
What does the experience in Massachusetts tell us, especially the struggle they've been having financing that plan?
Well, I think you have a number of things the Massachusetts plan has done. One, it shows that you can actually have a partnership between the private sector and the public sector. So what you've done is strengthen private insurance companies and strengthen employer-based insurance. At the same time, you recognize that there are people who cannot afford insurance, whether their income levels are too low or whether they are a small business that cannot compete and negotiate with insurance companies and have the same efficiencies and have the same negotiating power that a larger company does. So by creating an exchange, you create access for the many who are uninsured, and you make a commitment to helping them pay. But on the other hand, they also have to pay a portion of their insurance, and you also create a place that small businesses and the self-insured or the self-employed can go to find affordable insurance. And the benefit to all of us is that it brings down the cost of care across the system. Also lost in this discussion is a really important insurance reform debates that that are so significant to every American, whether it's saying an insurance company can no longer exclude you from coverage.
Well, we just got a Democrat and Republican agreement on this show about the insurance reforms. Brian Bilbray is ready to go with that.
And there's some others. You know, you cannot have a lifetime cap on people's what an insurance company is willing to pay out. You cannot drop someone when they become too expensive. You cannot do rating. Your insurance premiums cannot be based on gender. So I would hope that my colleague from California could agree on those as well, because
Brian Bilbray,
so
you can agree on those insurance reforms, can't you?
Lawrence, I can agree on a lot of things as long as we understand that when we put mandates on the insurance options, instead of going to the credit union option that I think that we ought to be looking at, let's not just look at the government option. Let's not look at big business. Let's allow independent people to make independent decisions, and let's not have a situation where we ignore not only the quality quality, but the cost is the big one. And the next big crisis, you mark my words, Lawrence, and Nikki will jump on this, you watch, that the next big crisis within the decade is not do you have insurance, but do you have a doctor? Do you have a nurse? These are all things that nobody wants to talk about right now, but if we're going to talk about comprehensive, we need to talk about these kind of coverage issues. We got to talk about costs. We got to talk about the whole issue of how we're going to get the lawyers not to take a pound of flesh out of this issue.
All right, Congressman Bilbray,
That's the challenge.
we'll bring you back to talk about that. Thank you, Congresswoman Tsongas. And